Indication: WELLBUTRIN XL, bupropion hydrochloride extended-release tablets, is indicated for the treatment of major depressive disorder, MDD, and for the prevention of seasonal major depressive episodes in patients with a diagnosis of seasonal affective disorder, SAD. Periodically reevaluate long-term usefulness for the individual patient. Important safety information. Warning: suicidal thoughts and behaviors, suicidality and antidepressant drugs. Antidepressants increase the risk of suicidal thoughts and behavior in children, adolescents, and young adults in short-term trials. These trials did not show an increase in the risk of suicidal thoughts and behavior with antidepressant use in subjects age 65 and older. In patients of all ages who are started on antidepressant therapy, monitor closely for worsening and for emergence of suicidal thoughts and behaviors. Advise families and caregivers of the need for close observation and communication with the prescriber. In the 20 years since its FDA approval, branded WELLBUTRIN XL has maintained reliable production methods and design construct. For 2 decades, WELLBUTRIN XL has been manufactured in North America with a patented and proprietary delivery system to ensure a steady release of WELLBUTRIN XL over 24 hours for patients with major depressive disorder or seasonal affective disorder. A reliable method of production leverages quality control systems, helping maintain uniformity across tablet strengths and prescriptions. WELLBUTRIN XL is tested in a fully equipped facility with modern, technologically advanced instrumentation. This 100% data integrity compliant manufacturing facility has been the consistent facility for production of WELLBUTRIN XL since its FDA approval in 2003. WELLBUTRIN XL is available in 150 mg and 300 mg tablets and features SmartCoat technology, which means WELLBUTRIN XL comes in a small tablet size regardless of the prescribed dosage strength. SmartCoat technology is a proprietary coating that allows high-potency treatment to fit in a small-sized tablet. The outer coating protects against moisture with a thin, very strong molecular diffusion membrane that allows moisture to permeate without affecting the integrity of the outer coating. This, in combination with a porous inner coating that controls the release of the bupropion salt, allows patients to receive a steady release of medication as illustrated in this chart, showing steady-state plasma concentration over 24 hours. Since its approval, WELLBUTRIN XL has been prescribed more than 51 million times by more than 440,000 prescribers and counting, because experience matters. Indication: WELLBUTRIN XL, bupropion hydrochloride extended-release tablets, is indicated for the treatment of major depressive disorder, MDD, and for the prevention of seasonal major depressive episodes in patients with a diagnosis of seasonal affective disorder, SAD. Periodically reevaluate long-term usefulness for the individual patient. Important safety information. Warning: suicidal thoughts and behaviors, suicidality and antidepressant drugs. Antidepressants increase the risk of suicidal thoughts and behavior in children, adolescents, and young adults in short-term trials. These trials did not show an increase in the risk of suicidal thoughts and behavior with antidepressant use in subjects age 65 and older. In patients of all ages who are started on antidepressant therapy, monitor closely for worsening and for emergence of suicidal thoughts and behaviors. Advise families and caregivers of the need for close observation and communication with the prescriber. Contraindications: WELLBUTRIN XL is contraindicated in patients with a seizure disorder, patients with a current or prior diagnosis of bulimia or anorexia nervosa due to a higher incidence of seizures, patients undergoing abrupt discontinuation of alcohol, benzodiazepines, barbiturates, or anti-epileptic drugs, patients taking other bupropion products, including Zyban, patients taking a monoamine oxidase inhibitor, MAOI, or within 14 days of discontinuing MAOI treatment, patients with hypersensitivity to bupropion or other ingredients of WELLBUTRIN XL. Warnings and precautions. WELLBUTRIN XL is not approved for smoking cessation treatment. However, bupropion HCl sustained release is approved for this use. Post-marketing reports of serious or clinically significant neuropsychiatric adverse events with smoking cessation treatment have included changes in mood, including depression and mania, psychosis, hallucinations, paranoia, delusions, homicidal ideation, aggression, hostility, agitation, anxiety, and panic, as well as suicidal ideation, suicide attempt, and completed suicide. Observe patients attempting to quit smoking with WELLBUTRIN XL for the occurrence of such symptoms and instruct them to discontinue WELLBUTRIN XL and contact a healthcare provider if they experience such adverse events. Bupropion is associated with a dose-related risk of seizures. The dose should not exceed 300 mg once daily. Increase the dose gradually. Discontinue WELLBUTRIN XL and do not restart treatment if the patient experiences a seizure. Use with extreme caution in patients with a history of seizure or cranial trauma, or in patients treated with other medications that lower the seizure threshold. Treatment with WELLBUTRIN XL can result in elevated blood pressure and hypertension. Assess blood pressure before initiating treatment with WELLBUTRIN XL and monitor periodically during treatment. Antidepressant treatment can precipitate a manic, mixed, or hypomanic manic episode. Prior to initiating WELLBUTRIN XL, screen patients for a history of bipolar disorder and the presence of risk factors for bipolar disorder. For example, family history of bipolar disorder, suicide, or depression. WELLBUTRIN XL is not approved for the treatment of bipolar depression. Depressed patients treated with bupropion have had a variety of neuropsychiatric signs and symptoms, including delusions, hallucinations, psychosis, concentration disturbance, paranoia, and confusion. Some of these patients had a diagnosis of bipolar disorder. In some cases, these symptoms abated upon dose reduction and/or withdrawal of treatment. Discontinue WELLBUTRIN XL if these reactions occur. The pupillary dilation that occurs following use of many antidepressant drugs, including WELLBUTRIN XL, may trigger an angle closure attack, angle closure glaucoma, in a patient with anatomically narrow angles who does not have a patent iridectomy. Anaphylactoid anaphylactic reactions have occurred during clinical trials with bupropion, as well as rare post-marketing reports of erythema multiforme, Stevens-Johnson syndrome, and anaphylactic shock associated with immediate-release bupropion. Adverse reactions. The most common adverse reactions that occurred in at least 5% of patients treated with bupropion HCl sustained release, 300 mg and 400 mg per day, and at a rate at least twice the placebo rate were anorexia, dry mouth, nausea, insomnia, dizziness, pharyngitis, abdominal pain, agitation, anxiety, tremor, palpitation, sweating, tinnitus, myalgia, urinary frequency, and rash. Drug interactions. An increased dose of bupropion may be necessary if co-administered with CYP2B6 inducers based on clinical exposure, but should not exceed the maximum recommended dose. Bupropion inhibits CYP2D6 and can increase concentrations of antidepressants, antipsychotics, beta blockers, and type 1C antiarrhythmics. Consider dose reduction when using with bupropion. Dose bupropion with caution when used with drugs that lower seizure threshold. CNS toxicity can occur when bupropion is used concomitantly with dopaminergic drugs. WELLBUTRIN XL can cause false positive urine test results for amphetamines. Use in special populations. Pregnancy. Use only if benefit outweighs potential risk to the fetus. Healthcare providers are encouraged to register patients in the Pregnancy Exposure Registry by calling 1-844-405-6185 or visiting womensmentalhealth.org/research/pregnancy registry. In patients with moderate to severe hepatic impairment, child Pew score 7 to 15, the maximum dose is 150 mg every other day. In patients with mild hepatic impairment, child Pew score 5 to 6, or renal impairment, glomerular filtration rate less than 90 milliliters per minute, consider reducing the dose and/or frequency of dosing. Advise patients to read the FDA-approved patient labeling, medication guide. Inform patients, their families, and their caregivers about the benefits and risks associated with treatment with WELLBUTRIN XL and counsel them in its appropriate use. To report suspected adverse reactions, contact Bausch Health at 1-800-321-4576 or FDA at 1-800-FDA-1088 or fda.gov/medwatch. Please see full prescribing information, including boxed warning regarding suicidal thoughts and behaviors.